Thank you. Thank you very much. I'm going to just present key findings so as not to take away the suspense and the joy of reading the whole report yourself. I'm very briefly, I've got a number of slides, and I'm going to go through them very quickly. If you can move to the next one, please. Yeah, okay, next one. So this is something that has been mentioned earlier in this in the presentations earlier. Africa has indeed made a lot of progress, especially since 2000, on various indicators. The graph on top is on the life expectancy, and as you can see, Africa is in the red line, and the life expectancy curve has been going up, particularly since 2000, where it has really jumped up, and it is now trying to catch up with the other regions in the world, though there's still a long distance to go. In terms of the mortality numbers, all the key mortality indicators, infant and child mortality and maternal mortality indicators have declined between 2000 and 2017. So in that sense, there has been a considerable progress on the health indicators and health outcomes in Africa. And if you move on, a key finding of this report, which we all, many of us knew about it, but we are able to put some numbers, is that Africa is indeed healthier in 2015 than it was in 2000. And while it does seem a little bit obvious from the previous one on decline in mortality indicators and increase in life expectancies, this one takes into account the disease-adjusted life years, the DALYs. And if you look at it on a per 1,000 basis across countries, all the green dots are the ones for 2000, and all the red dots, each country has dropped down in 2015. And even the average for Africa is the green horizontal line has come down to the red horizontal line in 2015. So there has been remarkable improvements in health. Though with varying rates, you can see for Rwanda, of course, is the highest. It has got the maximum dip in the disease burden. And overall, if you see on the left-hand corner, North African countries are already better off than the other sub-regions. Now, to look at some of the challenges that the countries are facing in Africa, these challenges are a result of some transitions that are undergoing. We know about the demographic transition because of very high population growth rate. The mortality rates have declined, but fertility is still high, and as a result, population growths are high. And therefore, we have a changing age structure. So by 2050, it is estimated that we will have, on the one hand, nearly 320 million more children, but at the same time, on the other end of the age spectrum, we will have more than 100 million elderly. And so both of these groups have very different health needs, and that is something that we need to cater for going forward in terms of planning for our health systems. Similarly, urban transition. Africa is urbanizing rapidly, and so as a result of which lifestyles are changing and which have an impact on our health needs. At the same time, urban growth is unplanned in most countries, and that also impacts on increasing the communicable diseases. And that brings us to the epidemiological transition in the sense that we have a double disease burden. So, of course, we still have communicable diseases which constitute more than half of the total disease burden, but at the same time, the non-communicable diseases are increasing. And so this is something that the health systems have to account for. At the same time, and this is something which is very worrying, in the next slide, we have the systems. Our health systems are not resourced sufficiently enough. The human resource challenges are immense. So we have below the WHO threshold, the bottom red line, horizontal red line of 23 health workers per 10,000 population. Only 10 countries out of the 48 for which we have the data are above that bottom red line. And a large number of, I think, 13 countries are not only below 23, they have less than 5 workers per 10,000. And Niger and Somalia have less than 2 per 10,000. So in that sense, the ability of the health system to respond to the health requirements and the challenges becomes much more of a much bigger if we take into account the fact that the human resource challenge is huge. Moving on to the financing, which is one of the pillars of this report. The two pillars are the financing and the role of the private sector. So one of the on the pillars of the report on the financing, if you look at very carefully on some numbers, some of it has been mentioned earlier today. So while as a percentage of GDP, the range has been between 5 and 6% of GDP, though on a per capita PPP basis, the expenditure has almost doubled. But what is worrying is the red circle, which is the out-of-pocket spending, where even though it has declined from 2000 to 2015 from 45% of the total health expenditure to 36, it still constitutes the largest component. And very interestingly, there is a huge variation. So for Seychelles, for example, we have about 2.5% as out-of-pocket expenditure. And we have countries like Equatorial Guinea and Nigeria and Cameroon and Comoros, which have more than 70% out-of-pocket expenditure. So there's a huge range. This is an average across the African continent. And that is what is worrying. The domestic spending, which is the column on the left-hand side, which is what the government spends, has actually declined a little bit. And the external assistance, which is the donor funding, and we talked a lot about it a few days ago at the Global Fund meeting, that has increased as a proportion of the total, but then that is very volatile and variable, and it doesn't necessarily go where the countries need them the most. So that is something that is something that we need to take into account. But the main point is that the out-of-pocket spending still remains the highest component. What are some of the other trends in Africa as far as the funding is concerned, if you go on to the next one? Is that overall, across the world, richer countries spend more on health. As countries become richer, they spend more on health. Unfortunately, in Africa, it is like a very huge variation. So only a few countries are on the trend line in the middle of this graph, whereas, and there is a clustering at the bottom where the countries which are poorer are spending very small amounts as GDP per capita PPP and the government expenditure. But as the countries become richer, so if you have the countries, look at the countries below the trend line, Gabon, Equatorial Guinea, Angola, Nigeria, Congo, all of them spend less than what they should be spending at their levels of income. So there's a huge variation. Globally, if you look at the figures, there's a lot of clustering along the trend line, which is not the case in Africa. Similarly, if you go on to the next, out-of-pocket expenditure, as countries become richer, out-of-pocket expenditures should decline. But this is not happening in Africa. There is no trend. And this is something very unusual and worrying. And this is something that we need to keep in mind also when we look at the external assistance. And one of the factors could be that as countries become richer, external assistance might have declined, but at the same time, the government spending has not increased. And so that could be the reason why the out-of-pocket expenditure is all over the place. The next slide is something that has already been mentioned about, the $66 billion financing gap across the continent. This is an empirical estimate looking at if 5% of GDP is what the countries should be spending, then based on the current expenditure and the current GDP, how much is the financing gap, how much below the optimum level they are. And we come up with a figure of $66 billion, which is more or less similar to what has been calculated by a group of researchers, a group of WHO researchers in a journal in the Lancet. Though incidentally, that is a conservative estimate because as we know, the cost of healthcare is increasing, and therefore over the years between now and 2030, the cost of healthcare is going to increase further. And so this figure is very soon going to be outdated because the cost of healthcare is increasing and the aspirations and demand for health is increasing. But this is a ballpark figure, and it tells us that on that 5% of GDP level, Nigeria needs nearly 1/3 of that $66 billion, about $31 billion, and Egypt also. Even though Egypt does spend on a per capita basis, it does spend above threshold level, but still on a per capita, on a GDP level, it is still much below. And the two countries together make up half of this 66 billion. Now, what should we do about it? So, of course, the countries are mobilizing. The next one, please. Mobilizing domestic resources. There are a number of ways they can do it. The increasing tax revenue has been talked about, reducing the debt burden, getting into debt-to-health swaps, which is becoming popular again, reducing illicit financial flows. And this is something very interesting which came out, that many countries have illicit financial flows, the size of this, which is much higher or much bigger than the financing gap in their particular country on health. And so therefore, if the illicit financial flows could be reduced, maybe a lot more money could be made available for healthcare spending or even other social sectors. Also, at the same time, reallocate budgetary flows and rationalize inefficient fossil fuel subsidies. This is something which is very important, though reallocation of budgetary flows can be a political issue and maybe not easy all the time. At the same time, given the fact that many countries in Africa have large amounts of natural resources, so earmarking of revenues could be another way of mobilizing domestic resources. And at the same time, and this was mentioned earlier, there is an attempt to identify innovative financial mechanisms, and one of those which have been tried out and which have been, which is becoming popular now, is the development impact bonds. The cataract bond in Cameroon is one of the examples, and so there are a number of ways in which financing mechanisms could be tapped into. Now, given all this data, this is a very quick snapshot. Given all this data, what we tried to do was to get a sense of, if we put all the data together, what picture do we get? And if you look at these 7 indicators, the domestic government health expenditure, out-of-pocket expenditure, density of skilled health workers, the average disease burden, the average government debt to GDP, which gives us the idea of the fiscal space, and the average annual GDP. So is the country growing or not? And if we put the thresholds there in the second column as 5% of GDP, which is the accepted one, $86 per capita, and 20% of total health expenditure is considered to be somewhat optimum. The out-of-pocket expenditure should not be more than that. And the density of skilled health workers is 23 by WHO, so if we keep that as a threshold. So if we combine all of these, and the Delhi's 538 we use because that is the average for Africa. So if countries are below, then they are stressed in terms of the disease burden. And similarly, for government debt to GDP ratio, the average for Africa is 57% of GDP. And so if we keep that as a level, and what do we get? And average annual GDP growth very low at 2%. So if the country is growing at the rate of 2% per annum over the last 3 years, what do we get? And we realize that if you put those there, the last column, if it is less than 5% and less than $86 and other indicators, what do we come up with? And if you go on to the next slide, if you take those 7 indicators, we realize that 8 countries are really health stressed, what we call them as health stressed, because they are stressed in 6 or more of those indicators that we have just seen in the previous one. And another 12 are stressed in 5 of those 7 indicators, so which we categorize as very health stress, means that governments are spending less, out-of-pocket expenditures is high, the density of skilled workers is very low, disease burdens are very high, and the governments don't have much fiscal space to spend on health. So in a sense, in kind of a double, triple, quadruple septa whammy, I think, from all directions, if these countries are pressed from all directions. So neither are they able to spend more, as a result of which their people have high out-of-pocket expenditures. At the same time, the health infrastructure is weak, and so therefore you have a fewer number of health professionals. And as a result of combination of those 7 indicators, we find these 20 countries are particularly health stressed and need immediate attention. So in a sense, we could use this dashboard as a way of prioritizing the countries. And so these 20 countries, and very interestingly, 13 of these are in West and Central Africa. So it does indicate something that we need to pay attention to. Coming to the next pillar, and I don't think I have much time, coming to the next pillar of the report, the private sector, yes. We have looked at, and this was talked about, so I'm not going to talk about this $259 billion market for the private sector is huge, business opportunities, potential to create 60 million jobs between now and 2030. and also this whole pharmaceutical market of $14.5 billion. So there's a huge potential for the private sector. And I don't think this needs to be sold anymore aggressively to the private sector because the facts speak for themselves. How can the private sector engage in the next one? We have also talked about the PPP modalities, the public-private partnerships. That's one of the options. The next one, please, is one of the ways in which the private sector could engage. The next one, if you can quickly go on, but unfortunately, the survey that we have seen, yes, just very quick, last couple of slides. Yes, that's right. Yes, the service delivery, but they are focused only on two, service provision and health financing, and as in the next slide, the disease burden, they're opposite the disease burden. Excuse me, can I? Yes. And they're also unequally distributed. And if you can come to the recommendations, we can leave it to the people to themselves have a look. The next one, please. Next one, please. Yes, next one. There are some recommendations for both for the governments and the private sectors, which I'm not going to go into because my colleague is standing next to me. And what I'm going to do, and I'm going to encourage you to go through the report. Maybe that could be a very good incentive to look at the report. Thank you very much.